All right, good morning, Miss Green.
Hi.
So what brought you into our office?
About 2.5 years ago, January of 2017, I was working in the operating room and a patient woke up from surgery and attempted to jump off the table. And I reached across the table to get the patient so they wouldn't fall, and had a sudden severe pain in my lower back and my hip, and wasn't able to walk or stand. I was screaming. The pain was so bad. And I knew about this facility and I had heard about Dr. Levinston. So I came immediately over here, and I've been seeing Dr. Levinston and the crew ever since.
Definitely. So you said you've been coming here for about 2.5 years now. And what kinds of treatments have you been through?
Well, with the back injury initially, of course, it was adjustments, TENS therapy, ice, physical therapy, using the equipment, trying to strengthen the back, strengthen the muscles as he would do the adjustments. And it's gone to the point now where y'all have offered a new program called the Prolozone, and I decided to try that, and it's wonderful. I now have absolutely no pain.
And how long ago would you say that you started the Prolozone?
Today actually is my 6th injection, and I felt 100% relief after the 5th injection.
That's amazing, Miss Green. So you also mentioned that you were having knee pain as well.
I have a history of what's called grade 4 chondromalacia, which means I'm a knee replacement candidate. Because I'm a nurse for 41 years, I've been standing on these crazy knees all this time and putting the stress on them. And about 10 years ago, I started with the Supartz injections in my knees. And I decided, since I was here anyway, this is like my one-stop shop, I would go ahead and get the Supartz injections here instead of going back to my orthopedic surgeon. So Doc takes care of my knees, takes care of my back. I was in a very bad car accident in April of 1977, and I had actually lost the curvature in my neck. My neck had minimal range of motion, but I had learned to live with it. I had constant headaches every day, learned to live with it. And Doc said, I can fix that. And I said, it's been, over 35 years. Nobody can fix it. And he says, I can fix it. And guess what?
Look at you go.
Doc fixed it. I can actually move my neck and I have no more headaches.
And that is 30 years of pain that you were just dealing with.
Every day.
Wow. So I see that the neck pain had limited you, and I know the back pain definitely. You came immediately in.
Yeah.
How were those pains affecting you? Was there anything you were unable to do because of them?
Well, as a nurse, a recovery room nurse, I obviously have to stand every day. And the shifts are anywhere between 10 and 12 hours. So after about 4 hours, I would hurt so bad standing up that some days I'd go home and I would just sit in the recliner and just cry because the pain was so bad. So it affected work. I love to garden. That's my hobby. And I couldn't get out in the yard and garden because I couldn't bend over. If I got down to pull a weed or something, I couldn't get back up. Sitting hurt, sleeping, no way to get comfortable. I don't care how many pillows. My life was just miserable.
So your quality of life was definitely down.
Absolutely.
So after you've been here for about 2.5 years, how would you say you're feeling now?
Wonderful.
Are you able to do the things that you were once unable to do?
I can do anything now. I'm back to being the young, active person, that I've always been, defying my age.
That's awesome, Ms. Green. So how would you say your experience has been here in our office?
Everyone here is wonderful. Everyone always has a smile on their face. They're happy to work here. You can tell everybody gets along with everybody. Everybody cares about the patient. I did have a little tweak one day at work where I started having pain in my back from a motion I had done at work. I called and said, dude, I am hurting really bad. Can I come in? And they said, absolutely. When you get off work, come straight in. We'll work you in. So everyone here really, really cares about the patient. Everybody here really, it's like a family. You know, you get a hug, you get a pat on the back. They care about you. They care about your family. It's wonderful. It's paradise.
Thank you, Ms. Green. And would you recommend this treatment to anyone else in pain?
Absolutely. I was very skeptical about the Prolozone at first. It was like, oh yeah, right. You know, here's a wacky quacky or something. You know.
Right.
But I went ahead and did it, and I'm very glad I did it. I'm not the type of person to sit still, and I was having to not sit still, but
Limit what you were
get
doing.
comfortable, you know, constantly moving and shifting and turning and lay down, sit down, stand up, whatever to get comfortable. And this Prolozone therapy it's a miracle.
Awesome. Thank you so much, Ms. Green.
You're welcome. Thank you.